For the Avs fans, the highlight of the series has, of course, been the return of Captain Gabe Landeskog. He returned to the team last week, and it was his first game in almost 3 years as he recovered from knee injuries and a knee cartilage transplant surgery.
We're going to talk about this more. We're joined by our 9 News medical health expert, Dr. Pyle Coley, to kind of dive into this story. Can you explain? I mean, we understand this was an intense, serious surgery that he went through. What exactly happened? What is a cartilage transplant surgery?
Yeah, so the joints of our knees, the two bones of the knees, they come together and they have a little sort of padding in between, and that's called our cartilage. And cartilage usually doesn't have a lot of blood supply, so it's very slow to heal, if at all. So essentially what he had was something called a cartilage transplant, because people who overuse their joints, especially young athletes, we often see knee pain and knee issues occurring because the cartilage starts to wear down, then you're getting bone on bone, essentially. So they actually take out a piece of your cartilage, grow it up in the lab and put it back in, or sometimes they take it out from a different part of the knee that's not weight bearing and put it in. So it's almost like getting your brake pads refreshed, so to speak, when you have the surgery. Now the surgery itself is not such a big deal. It's done arthroscopically, so small incision with a camera put into the knee, but the recovery certainly can be, because you can imagine it takes time for that to heal.
Yeah, I mean, from what I know, it took him 3 years just to get back on the ice, right? So how long, from your medical perspective, would somebody in his type of shape take to get back into shape? What kind of OT, PT would be involved?
Yeah, so if you think about it, the things he has going for him, he's a young, healthy athlete, right? So his tissue is really, really healthy. But what's counting against him here is that he needs to put a lot of stress on that joint, right? He needs to skate hard and he needs to spin. So you want to make sure he's completely healed. So in general, it takes about 6 to 12 months. Some people can take 18 months to get back to full range of motion. And as you're healing, you want to make sure that you're doing that PT and that OT, because it heals with scar tissue. Scar tissue limits flexibility, limits range of motion. It can cause long-term problems like pain and locking of the knee, all of which would count against him. So I imagine for him, the recovery may have been slower because of the fact that he's an athlete. He needs more use of his joints.
If you think about it, he's an athlete, a national championship athlete, you know, the great physique. What about the rest of us? Like knee pain, I feel like it's one of the first things I'm like, oh, my knees, like when I'm getting up.
No, Alex,
after playing with my kids. No, I'm serious.
I know, mine's my back.
It's your back. It's something.
So extremely common. 25% of us will have knee pain sometime in our life. And as we get older, it actually becomes 30, 40% of us. So if you look at the younger age groups, it can often be overuse, runner's knee, you know, you're not stretching before exercise, what have you. But in middle ages, it's the signs of early osteoarthritis, which is that wear and tear arthritis when that cartilage starts to wear down. And in fact, the muscles that support our knee, ladies, we start to lose muscle mass at the age of 30. And so the muscles that support our knee become weaker, so that puts more stress on the knee. Sometimes we get a little extra weight in our middle ages, and that's putting more stress on the knee. We're not as active, we're being more sedentary. So arthritis starts in your 40s, and really in order to prevent it from manifesting so that you don't need a knee replacement later in life, you need to do active measures.
Active measures.
Wow.
I feel like all of a sudden I need to get going.
You do need to.
Okay, so for some of the viewers that are watching, echoing Alex's sentiment, saying, I also have knee pain, when does someone know that this has become chronic and they should actually go seek medical attention?
Right, so I would say there are some red flags to watch out for if you have knee pain. So the first is if the joint locks or gives way, like it's not stable. That's certainly a red flag. If it's extremely swollen or red, or if there's any systemic symptoms like fever. These are absolute red flags, you go right away. Otherwise, for the most part, you can kind of sit on knee pain for a few weeks, say 3 to 6 weeks, and see if it resolves. If it's happening every day, it's happening at night, or it's getting in the way of you being able to function, like climb stairs or what have you, that's a time to talk to the physicians.
Is there a specific knee doctor, or you just go to an orthopedist?
Yeah, so orthopedist would be a good starting point, but sometimes that's a surgical doctor, right? So if you want to do, you know, more of sort of a medical management, which we would recommend always, first 3 to 6 months, try with physical therapy, what have you. You start either with your internist, your general doctor, or a physiotherapist, a physical therapy type of doctor to help diagnose. Sports medicine or orthopedist, I think, tends to be in people who have a clear reason for having knee pain and a trauma. But you know, the decision to have surgery is a complicated one. I tend to tell my patients to delay it as long as they can, because your knee's never the same once you've had surgery. We're hopeful that he'll recover with his knee transplant, and you know, hopefully it won't get in the way of his ability to skate and perform. But the knee is one of our tough joints. It takes a lot of weight, and we really need to work on strengthening the muscles that support it. You know, our quads, our glutes, even our core, our posture, and making sure we're stretching our knees and exercising every single day.
No, to
Dr.
see Gabe,
Coley.
like, he had that big hit, like he would have been on the ice for like 30 seconds. I'm like, Gabe, no, your knees. Like, it's intense. It's such a serious surgery.
Well, and then once you've had surgery, you don't ever heal to full strength. So now if he got trauma to his knee, it would be more easily injured than before he had the surgery. So certainly, things for us to watch out for.
Okay, Dr. Coley, thank you.